people are divided and where they have to be. If you don't mind, while you're waiting, just to help um, Sandra keep track of things, if you wouldn't mind just signing into the chat, just who you are, what organization you're with. That way it kind of helps her. Okay, we'll give it one more minute. Okay, we'll get going here. I think folks will be coming in. So good morning, everybody. Thank you for taking your Friday morning to be with us. It's a beautiful day in the Triangle area. I hope you're having good weather where you are also. So there's a lot going on. It's been quite a month, hasn't it? Of of just trying to keep up with what's going on. So we'll have the opportunity to talk about some of those things today and to just kind of see where we stand on things, but it's good to see everybody here for sure. For those of you that are signing on thinking you're going to have Secretary of Health and Human Services with us today, I hope you saw the notice that he did have to cancel. There's a lot going on. I do know that right now he is at a press conference with Representative Ross. She is doing a press conference in Raleigh. About potential cuts in Medicaid and other types of things. He has rescheduled to our next meeting, which is March 28th. So we're glad that his office is already committed to that. Um, we were asked to be a part of the press conference too with Representative Ross, but one of our secretary treasurer of our board is there, as well as she helped to line up some speakers of some family members to also talk at that press conference about what the impact of Medicaid cuts would mean for their loved ones and for their families. So we're glad that we could that we were able to help make that connection also there. So welcome. We've got a full agenda today. Even though we don't have a secretary, I think you'll be real pleased to see, and we've notified you of this ahead of time, that Dave Richards, who used to be the state Medicaid director and is probably the guru of Medicaid in North Carolina, is going to be with us and just offer some insights about that, as well as other things going on in North Carolina at this point. All righty. So as I said, Lee Dobson, who's our Secretary Treasurer, could not be here today because she is at that press conference. But I'll just cover real quickly the minutes and Treasurer's report. You were sent the minutes of the last meeting when Sandra sent out the meeting reminder. Those minutes have also been online on our website, posted since the last meeting. I don't know if anybody had any questions relative to those or not. If you do, just say so and we'll go over anything you might have relative to that. Okay, I'm not seeing anybody, so we'll just let those stand as they are then. As far as financial updates, we're in pretty good shape budget wise right now. We did get our yearly funding from the Z. Smith Reynolds Foundation, which funds our essential jobs and essential care work primarily. We're excited about that. United Healthcare has committed to be a premium sponsor again for this year. So we're very excited about that also. We were able to accumulate a little more money in the budget since we did not pay an executive director's salary from mid-September until Sandra came on board in February. So that certainly helped the budget heck of a way to help a budget, but it did. It certainly did help a little bit there. So that's good. And other than that, we just had the routine expenses and things of that nature. So we are, I think, in pretty good financial shape right now. We do want to look at what the future might hold financially and try to look at ways that we can grow the revenue coming into the coalition. You know, if we want to do all the things that we ideally would like to do, we've got to have more revenue to do it. So we're going to be looking at having a committee to come together that can kind of look more at planning financial sustainability going forward and looking at an increase in our revenue. So if you have any interest in that type of thing, let me know, and certainly we'll make you a part of that committee that's going to be doing that. So moving forward, you know, every meeting we have a member or a partner organization just to come and talk to us, share a little bit about what they're doing. We've got somebody today I don't think is probably a stranger to most of you. Melinda Munden is the Director and Deputy Commissioner for the SHIP program, the Seniors Health Insurance Information Program in the Department of Insurance. And they are a partner group with the coalition, have been a sponsor of many things that we've done, and just a group that we have worked with ever since our existence. So Melinda, we're glad to have you today. We know that you guys, it's been a crazy time for y'all too, because I know you get a lot of federal money. So thanks for being here, and we look forward to hearing what you've got to say.
Great. Thank you, Mary, and thank you, Sandra. It was, okay, Mary, I'm trying to see if I can share, and it's not letting me share my screen.
Okay.
If you can do that for me, I can start chatting.
I'm trying on this end.
You're fine on your end? Oh, now I can, wait.
Can you do it?
Let me see. It's telling me sharing is not turned on.
Yep, you should be able to now.
Now I can, great. Let me know if I can get a thumbs up from folks if you all are able to see it. That would be.
Not yet, but I assume you haven't pulled it up yet.
I did. What in the world?
Is it on the right screen?
Yeah.
It's coming. It's coming. Yeah. There you
Okay.
go. We got it.
Good. Well, it was great seeing so many of you this week at the Aging Conference. I was only able to be there on Tuesday. Sandra, I hate that I didn't get the opportunity to meet you, but I know several of my folks did. So Mary, just thank you to the coalition for inviting us to present today to give some background on SHIP and let you know what's going on in our world. I told Mary I have a few slides here, but I'll be fast. So, but I imagine going to share these with folks. So if you've got questions, Kevin Robertson's also on, and Kevin is a longtime friend and colleague, and he said he'd be willing to man the chat, Mary and Sandra, if that's okay with you. So let me see, did it go? No, it's not going. What am I doing wrong here? There we go. All right. So just a little bit of a background about SHIP. We're pretty proud of the fact that we were one of the very first ones in the country. We were founded in 1986. Many of you know the name Bob Jackson and Carla Obial, and they had split the state in half. And they were going to local communities to recruit older adults to become SHIP certified volunteers and help people in their local communities with questions that were relating to Medicare, and at that time, Medicare supplement plans and long-term care insurance. And it grew exponentially, so much so that Jim Long, our former insurance commissioner, went before Congress. And as you can see, that it was mandated in 1990 through the Omnibus Budget Reconciliation Act, that every state have a SHIP program. Funding was not available initially, but that did happen over time. And at this point, we have $54 million that's appropriated to 54 states and territories. That's not a lot of money when you think about it. And I think you'll see that as I move forward with the cost savings that we alone, just as one state, have been able to afford a lot of our consumers. North Carolina, we're fortunate we do receive some state appropriations. We're forever grateful for that, and I'll talk about that a little bit more later on. Most SHIP programs, though, do not. So our role is with SHIP is to provide free, unbiased information and education to Medicare beneficiaries, their families, and caregivers, so they can make the most well-informed decisions as it relates to their health care. We don't sell anything, and we don't endorse any particular plan, product, agent, anything like that. So we are truly providing unbiased information. And if you yourself or have had a loved one or anybody you know that is eligible for Medicare, I always jokingly say you've probably never felt like a more popular person in the world with the number of materials that you get in the mail, the number of phone calls that people receive, and the amount of options that are afforded to people on Medicare is insane. And I say that in terms of just the options that are available. It's a lot of information to weed through to determine what is the best option for each person, because it's not the same for everybody. We also screen people for extra help in Medicare Savings Program, and that is done through the Medicare Improvements for Patients and Providers Act, something referred to as MIPA. We work closely with DHHS, with the Division on Aging, on that. We do a number of outreach presentations and being at health fairs and in a variety of areas where older adults and people who may be on Medicare due to a disability, to engage them, to let them know that we are available as a resource. And like I mentioned earlier, we have a vast volunteer network. We wouldn't be able to do the work we do without our great volunteer network. Within the SHIP program is the Senior Medicare Patrol program that's led by my colleague, Kevin. That purpose of this program is amazing. It is helping people, empowering them more than anything to identify and report Medicare fraud, waste, and abuse. I think we've heard this in the past few years for sure. They say it's about $68 billion annually that's lost to Medicare fraud. So just empowering people to look at those Medicare summary notices. If something doesn't seem right, question it. It may not be fraud, it may not be waste, it may not be abuse, but just even having the awareness of knowing, empowering yourself to know what's going on. We're getting calls these days as it relates to people receiving plastic Medicare cards. That's a scam. So just the fact that we're able to share that information with folks is so important. Again, it was authorized in 1997 under Titles 2 and 4 of the Older Americans Act and the Omnibus Consolidated Appropriations Act, that's a mouthful, and the Health Insurance Portability and Accountability Act of 96. At this point, the S&P programs gets about $35 million total, but $32.2 million is apportioned to the 54 programs, again, via a population-based formula. So not a lot of money from the national level for the amount of work that's done at the state level. So how we're structured, we are very fortunate to have a pretty big staff. At this point, we've got 26 full-time positions and 1 part-time position. 10 of those staff members man our 800 number. That's Monday through Friday from 8 a.m. to 5 p.m. You know, and I started with SHIP. Tomorrow is actually my 19th anniversary, folks. As a permanent employee, I started as a temp, but I was like, oh my gosh, it's been a while, huh? But I started on the phones when Part D started, and during the open enrollment period, it is crazy. And we used to joke that, oh gosh, after the Medicare open enrollment period, we would take a collective sigh and we would have it be a little quieter. Guess what? It's not quiet. It never is. And that's a good thing. I think that speaks to what we do and how we are able to help people. People are turning 65 every single day. People have questions about their coverage every single day. This past couple of years, the number of calls that we have received and inquiries we've received from members of Medicare Advantage plans whose hospital and insurance company have not come to an agreement for a contract. How does that impact them? Somebody moving to the area. So it's never a dull day around here. It's never quiet, which I think is a good thing. But with that, we have complaint analysts as well. that help people file complaints, whether it's with original Medicare, with a Medicare Advantage plan, whether Medicare prescription drug plan. We also do complaints for Medicare supplement plans and long-term care insurance, which those two particular products are actually regulated by the state Department of Insurance. All the other products with Medicare are related at the federal level, by the Centers for Medicare and Medicaid Services. So with a large portion of our grant funding, we are able to subcontract to community-based organizations in local counties to serve as SHIP local coordinating sites. And this is so valuable to the work that we do. It's interesting to me because I still hear people say, I'm not calling Raleigh. I'm not calling the big city of Raleigh. I want to be and go to get help with people that I know and I trust. And we recognize that value. As I said, I've said this for years. When I moved here from Michigan, I thought, why in the world is SHIP working with cooperative extensions? That did not resonate with me, but it truly made sense. And that's where people would go for that type of assistance. We have coordinators and volunteers that say, I had people come up to me in the grocery store that ask me questions about Medicare and how do I move forward with these things? And I think that just is so important to the work that we do, that we have that stronghold in those local communities. With those contracts, the local sites appoint a SHIP coordinator, and they serve as the conduit, so to speak, for SHIP in that community, and they oversee the volunteer network, oversee the grant, and then they support, like I said, those volunteers in the local community, because volunteer engagement has to match with the community itself and with the organization. It doesn't make sense for us to say, oh, you need to go here and that's a good fit. It's got to be a good fit at the local level, and they manage that for us. We work with a variety of community-based organizations. Gina Upchurch is not on this call, but she at Senior Pharmacist serves as our local coordinating site there. We work with senior centers, we work with AAAs, we work with Parks and Rec, depending on the area, and certainly cooperative extensions as well, and Council on Aging, and a whole host of places. In turn, the SMP program primarily works with the area agencies on aging, but we were able to expand that this year to our local coordinating sites as well. Our SHIP volunteers are co-trained, as SMP volunteers. You can't do the work of one without the other. And I think that's something that we find so valuable at SHIP in North Carolina. I'm not going to spend a lot of time on this. I think most people on this call know what Medicare is, but I just want to highlight that it is the federal individual health insurance for people who are over the age of 65 or under the age of 65 who've been receiving Social Security disability insurance for 24 months, or if they have under 65 with end-stage renal disease or ALS. Again, I mentioned earlier, it's administered by CMS, but Social Security is actually the entity that handles the enrollment and eligibility and entitlement for Medicare with that. So Medicare in North Carolina, and these numbers are pretty astounding. I just pulled this from CMS's data system yesterday, and it's as of February. So the number keeps growing, folks. We're at 2.2 million who are enrolled in Medicare. And 17% of that is due to a disability. So I think that highlights again that we are an aging state, and I think we all know that. And the number is just going to continue to grow, just for the people who are already living here and turning 65, but also the number of people who are moving to our state in a retiring capacity. As it relates to options available to Medicare beneficiaries, just this year alone, there are 16 standalone Medicare prescription drug plans and 163 Medicare Advantage plans. Folks, that's a lot. As a state employee, we have two options that are available to us, either or. Think about that. That's mind-blowing, and how a person is able to navigate that whole system, it can be overwhelming, and that's what support we're able to provide. I've mentioned some of this already. We provide comprehensive personalized counseling on all options. So when somebody calls us and says, I'm turning 65, it's not a 5-minute phone conversation. These can be in excess of an hour. going through every single nuance that's available to that person. Maybe they're continuing to work, maybe they've retired, maybe they have a spouse that's working. There is a variety of options. We review all of those options with every call that comes in, because that's our responsibility. We cannot promote a particular plan, product, agent, as I mentioned earlier, or insurance company. We utilize the Medicare.gov Plan Finder to do most of that work. And that is obviously housed by and managed by CMS. We screen and submit extra help applications. So when people contact us and say, I'm having a hard time affording this medication, we screen them for the eligibility for the extra help program. And if we think that they may be eligible for the Medicare Savings Program, we can make that notation on the application that it would in turn go to the state. So they would begin screening for a Medicaid application in our state. We assist Medicare beneficiaries, as I mentioned earlier, with billing disputes, issues, and make referrals to state and federal partners for suspected cases of Medicare fraud. But it even goes beyond that. You know, we get calls constantly from people who may be in a Medicare Advantage plan and hospitalized and needing to go to a skilled nursing facility, and their insurance company is denying it. These things happen, sadly, every single day. So the work that we do goes far beyond just helping people pick coverage. In addition to this, one thing I did want to point out just recently, we think of the folks in Western North Carolina who have been were probably unlikely and unable to make changes to their Medicare coverage during the Medicare open enrollment period, which ended December 7th. So those folks have a special enrollment period through disaster declared emergency, where they were able to make changes beyond that point. Several of them did so, and their enrollments were denied. They contacted us. We contacted Medicare directly, who also said, there's no disaster. We're unaware of this. Mind blowing, right? So we took it up the chain with CMS, and we got all of those people in coverage. I'm excited to say that. And I think about this as it relates to what could happen to our funding moving forward. And I'll talk about that a little bit more at the end. But if advocates like us are not there, it causes me great concern to think what's going to happen to Medicare beneficiaries. I talked about complaint assistance. So we've got 2 complaint analysts at this point, and last year they did over 1,000 complaints. That's a lot. And it could be a variety of things. It could be a claim denial. It could be being charged an incorrect premium amount. It could be, I'm enrolled in this plan and I never signed up for it. It runs the gamut. We do a fair amount of Medicare supplement and long-term care. Long-term care is, quite frankly, one of the biggest ones. A lot of that has to do with premium increases that have been approved. As I mentioned earlier, Medicare Part A, B, Medicare Advantage, which is Medicare Part C, and Medicare Part D are regulated by CMS. So we have the ability to enter these complaints into what's called the CMS complaint tracking module. And then those have to be, they're reviewed by the plans themselves with the oversight from CMS. So we do have the ability to do that. But as it relates to MedSup and long-term care insurance, we work directly with those companies because we are the regulatory body. We also oversee the agents that are licensed to sell Medicare products. So that's another shared thing that we have with CMS. So just some outcomes from last year. We helped over 70,000 people. And when you think about that, that's just 3% of our Medicare population. It doesn't seem like a lot, but I'll tell you what, we're very, very busy. And out of that, over 23,000 were just phone calls that came in through the SHIP office. And this is information that's reported. So we have a requirement that we have to report data to in a reporting system to ACL, who's our grantor. I'd love to tell you that every single contact is entered, but we know that's not the case. We wish it was so, but that just gives you an idea of the work that we do. We completed over 11,000 enrollments. over 8,500 of those were Medicare Part D, and over 2,600 were Medicare Advantage. And why I pointed that out is this. So just this past year, a lot of insurance companies opted to remove any type of commission to insurance agents who were selling Medicare Part D plans. So there was really no incentive, truthfully, financially, for them to do that. So many agents said, hey, Melinda, we're just going to refer people to SHIP if they need help with that. And that's great and wonderful too. So just wanted to point that out. Last year, and I have an asterisk next to that, we've saved consumers about $35 million. And the reason I have an asterisk is we're doing an audit right now that's a requirement of our federal grant, and we can't say that officially until they have reviewed that and give us the okay to do so. And then we processed over 1,000 complaints, and that number has just continued to grow too over the years. In addition to our local partners as our coordinating sites, we have so many community partners across the state, certainly the coalition. We couldn't do the work we do without all of you. We are excited to be a part of All Ages, All Stages. Kevin and I are working with Lee and with Bill Lamb on the long-term care and support subgroup. So we're looking forward to the work that we're going to continue in that capacity. So Mary mentioned at the beginning our federal funding. So at the end of, well, actually it was January 22nd. Federal health agencies were directed to pause all external communications effective immediately. So for us, we have not had any conference calls, any webinars, any type of communication with ACL since that time. We are able to have one-on-one conversations with our project officer, but in terms of receiving information from our grantor, we're not. And that's been challenging. And that also goes to CMS. CMS is unable to have those types of calls with us. I received an email a couple of weeks ago from our point person who we work with on complaints, basically saying, we can't talk to you at all about beneficiary complaints. We'll work directly with the beneficiary. This is challenging. This has been very hard for us. Not even a week later, the executive order came out from the president with the memo from the Office of Management and Budget that was putting an immediate pause on over 2,000 grant programs, and all 3 of our grants were included in that. So it has been an absolute roller coaster ride for us since that time. Fortunately, when the administrative stay was put into place, that allowed us to continue to access funds, and we have not had any pause since that time. But I will tell you, we are moving forward with trepidation. I've put on the screen the current federal grant awards that we're receiving, so you'll see the 3 of those. With MIPA, one thing I do want to point out just quickly, this is MIPA has 3 priority areas. Priority 1 is SHIPs, priority 2 is AAAs, and priority 3 is ADRCs. And we have applied for this funding since its inception in 2008. And it's been a collaboration with the Division of Aging at DHHS. And at their request, SHIP submits one statewide plan. And we receive all of the funding, and then they tell us how they want to subcontract the money for priority 2 and priority 3. So the SHIP-based grant is set to expire a month from today. And we are in our 5th year of a 5-year grant. So in December, I submitted the new 5-year grant application for the SHIP-based grant. When the temporary pause came out, that also paused the peer review committees from even reviewing grant applications that were coming in. Fortunately, we received word unofficially from ACL that they have been able to continue with that review. So the expected award date is April 1st. They are anticipating to be able to issue a partial award based on the currently approved budget amounts authorized by Congress through mid-March. However, all awards are subject to the availability of federal funds, and the majority of the funding for SHIP is through discretionary funding from Labor, Health, and Human Services. So we are really keeping an eye on what's happening at the federal level these days to see what happens with that. The SMP grant is in the second year of a 5-year grant. Current award is nearly $1 million. That ends on May 31st. Again, all those awards are subject to availability of federal funds. SMP funding is provided through mandatory and discretionary funding from the Healthcare Fraud and Abuse Control Program through the annual appropriations process. And then finally, the MEPA grant. This is a 1-year grant. This is really interesting. It's had bipartisan support for so many years, but I'll tell you what, it's been a challenge to have this continue annually. I don't know where this one's going to lead. It's at this point, our grant goes through August 31st. And like I said in here, it's been extended 12 times, but without congressional action, it's set to expire as well. So we'll see where that goes. So in terms of us, in terms of impacts, staffing is big. I'm going to be really frank with you. I've mentioned earlier, we have 26 FTEs and 1 part-time. Of that, 11 are funded through state appropriations, and 15.5 of them are fully supported through this federal grant funding. Folks, that's hard. I don't think he would mind me saying so. Kevin is one of those people that's 100% supported through federal grant funds. This is people. Additionally, the loss of funds to our local sites and AAAs, just this year alone, between those 3 funding, those grants, over $2.7 million went to local agencies. So that helps support probably workers at their end, you know, depending how that would be. And then obviously the biggest thing is assisting fewer people. And when I'm even saying assisting fewer people, the impact that that can have on those individuals is profound. These may be people that remain in coverage that is probably not the best thing for them. Maybe it doesn't cover prescription drug coverage, prescriptions that they need. Maybe it's too costly. Maybe they are in a Medicare Advantage plan and their providers are no longer a network and they don't know that and they remain in that plan. Maybe something fraudulent has happened with their Medicare number and they are unaware of that and they don't know what to do. Things that could happen are scary, very, very scary. And what a great way to end on that, right? But anyway, just want to thank you all for your support. We're not alone in this. I know so many folks that I talked to this week at the Aging Conference and so many people on the call. This is our issues are not limited to us. It's happening across the state. But hopefully we'll have some positive news. So Mary, I'll switch it back to you.
Well, it certainly is daunting when you think about it, that's for sure. So I was just trying to do some math. So really about almost $5 million of y'all's budget is federal funded. Is that correct?
4.7.
Plus 4.7, yeah. So how much do y'all get from the state? I mean, I know it pales in comparison to that.
Right. So we get a portion of what comes to the Department of Insurance. It's just under $1 million, Mary. But most of that is salary. You know, one of the things this past year, I can tell you for state employees that are on here, our health insurance went up. The cost of that exponentially. So when you think of salary, it includes fringe, it includes all of those things. That makes a huge difference.
Yeah, yeah. Well, I mean, I don't think there's anybody, when you go out and talk with people across the state, that everybody knows SHIP, or a lot of people know SHIP, put it that way. And so I think your reputation is really good. And I think a point that you bring out is that a lot of monies you get are funding people to serve, to be these folks that can help folks that have problems. So it's pretty daunting to think that, you know, that being caught up in this whole process. What questions do you guys have from Melinda relative to things.
Looks like Dick has his hand up.
Okay, Dick, go ahead.
Okay. Good morning, everybody. And thank you, Melinda, for that presentation. You guys are a very vital service. You know, I live at Carroll Woods, and we're one of your local sites, I believe, whatever the right term is. And I know we help out the people here a lot. But you mentioned the problem of people needing prior approvals and also having claims denied. This is serious enough that some states are legislating about it, and there's even a bill in the North Carolina legislature this year. I wondered, does the department think that this is serious enough so that some legislation could avoid some of these problems in the first place? And have you taken a position on that?
Thank you, Dick. I don't know that I can answer that question. I'll be honest with you. That is managed by leadership at the department. I don't know. I can ask that question. How about that? I'm unaware if the department is pursuing anything to that degree, but I'll find out. How's that?
Thanks for that. So I'm sure you guys are having to play the scenario game of what can we do, things of that nature. So and that itself is stress provoking. I know, but I assume you're just kind of going to keep going until you're told otherwise, right? So
Yeah, that is that's exactly what we're doing. Fortunately, and not at all surprising by this, we have profound support at the leadership with the department. And you know, there's a lot of work that I've got stuff that's due today to the North Carolina Office of Budget Management and OSHR. I mean, this is the impact that this is having across our state, just in university systems. And it's profound. I mean, so many people have already been let go in you know, certain areas. So yeah, every day you just hope for good news.
other questions that you might have for Melinda or Kevin, either one?
I have a question.
Go ahead.
What I may have missed it. I had to step away for a moment, but what training do the volunteers have?
Oh, thank you. That is a good question. I didn't really go into that. They go through an initial online training that is provided through the SHIP Technical Assistance Program. That is Technical Assistance Center, excuse me, that is provided to SHIP programs nationwide. It is an online training. I think there are 16 sections in that, but we also have additional components for long-term care and SMP. And then beyond that, our volunteers, certified volunteers, are required to participate in quarterly training. So they get that ongoing training throughout the year.
Y'all also do a lot of mentoring where, you know, if somebody has the opportunity to work with others. And
Oh, absolutely. Shadowing it. Yes. Yes.
And we ask our volunteers to do 40 hours of volunteer service per calendar year as well.
How many volunteers do you have now? You may have mentioned that and I didn't.
So it's about 700. And I always say it's 700 on the books, but not all of them are the same. You know, we used to have a fair amount of volunteers. Most of our volunteers, honestly, were older adults themselves that were retired and wanted to just give back. And a lot of our certified volunteers now actually go through the process just because of the work they do. So they may not be able to give us the same support, for example, during the Medicare open enrollment period, that maybe other people have the time to do that.
Well, Melinda, I know that a lot of particularly nonprofits and groups like that are looking at advocacy strategies for, you know, really getting behind things that might be on the chopping block. And I know you're part of a state government agency, but is the department looking at anything? And I know that this is tied up in the governor's position and everything too, but is there anything that y'all right now are doing as far as getting out the information about the value of what you do, or alerting your volunteers, and I guess the bottom line is, are the things right now that we could do to be supportive, and those on this call could do to be supportive of your efforts.
I appreciate that, Mary. I actually have a meeting this afternoon to discuss some of these very things. So I don't know if many of you know this, you may not, but the commissioner ended up having an elective heart procedure. So he's been recovering with that. So I haven't had the opportunity to speak with him, but I have a meeting with Jackie Obusick this afternoon, who's our chief deputy, to talk about these things. Commissioner Causey is very supportive of the SHIP program. Even at the end of the year last year, he sent letters to the North Carolina contingency, basically saying SHIP needs more money. This was before any of this happened. So I anticipate, Mary, that we'll have something coming down with maybe some talking points.
And this is the type of thing that we can also help to distribute around through our networks too, I think, to folks. Right. But and of course, one of the things that we certainly are finding is having people tell the stories is one of the most effective ways of
right. And and it's not, this is one in particular that we just had happen a couple of weeks ago. There was a woman in Granville County, I'll just real quickly tell you this, who had been through some real trying times. She was covered through her employer. Her husband got sick. She cared for her husband. He ended up passing away. She was taking care of her sister. She enrolled in prescription drug coverage, and they assessed a penalty for her for 111 months. She had provided a variety of information saying, no, I had coverage, and they kept denying it. Our volunteer just got that overturned. After years of fighting it, she just continued to go to bat, and it was $40 a month. And that doesn't seem like a lot, but that is a lot to some people. So the value of the work that we do, like I said, goes far beyond just explaining what Medicare is.
For sure.
And those stories are so important.
Well, thank you for coming today and just giving a good overview, but also basically sharing with you the reality of kind of what you guys are doing now. So we hope we can be supportive and help you in your efforts too. So thanks again. And these slides that Melinda went through today, we'll be sending these out the first of the week so that you will have these. And Melinda, your contact information was on the slide. I can't remember SHIP's contact information.
I put mine and Kevin on there in case people had questions.
And one last call. Anybody else have any questions? Or are we good? Okay, looks like we're good. Thank you. And thanks, Kevin, also for both of you for being here this morning. All righty. Well, unfortunately, this is a type of decisions and processes and discussions that agencies all over are having right now. So it's kind of the reality of where we find things right now. But let's move on. Let's look at basically updates coming from the coalition, and I'll turn it over to Sandra Phelps, who's our new executive director. She's actually been on board now for, gosh, Sandra, what is it now? You told me the other day it was 16 days. I think we're up to maybe 20 something.
15, 20, about 20 days, I think, something like that. Yeah. And I was able to fix it so we could share the screen. So hey, I'm doing pretty good. If I could, Mary, I want to defer my comments for a moment and let Trish go ahead and talk about the direct care workforce initiatives, because I know she has to be off at 11, and I want to make sure that she has a moment to speak about that instead of me trying to go over the information, and then I'll get back on.
All right, sounds great. And let's see, Sandra, for some reason, Melinda's still showing up as a presenter. I don't know how that is. But anyway, go ahead, Trish. Thanks.
You all, thank you. And I'm sorry for having an unavoidable conflict at 11 today. Wanted to first welcome Sandra in front of all of our colleagues. She has certainly hit the ground running, and I'm very grateful for the support she has already provided EJEC and our shared work together. And to also just acknowledge the amazing leadership that Mary has provided in the interim and continues to provide. So just wanted to give both of my coalition colleagues a shout out. On the direct care workforce front, our priority, and the big elephant in the room is the same elephant that's in everybody's room right now. We are very, very much focused on the conversations that are happening, particularly in the Medicaid space, related to budget cuts and the budget resolution that was recently passed, and kind of the potential impact on that, and then some of the ancillary state conversations that are also happening, and basically based on bills that have been introduced, and some of the federal dynamics that I know Mary will talk more about. So just wanted to recognize that we are working with our steering committee and our other partners, the North Carolina Family Caregiving Alliance, Serious Illness Coalition, AARP, to really develop and shape a unified path forward in our advocacy. So more information to come on that. We have met with the DHB leadership team in the last couple of weeks and are in continued dialogue with them to the extent they can be about how some of these conversations and issues that are happening at the federal level could potentially impact our state's Medicaid program. And then in addition to pulling data together that isn't always readily available. So things like looking at the rural impact on some of these potential cuts. And so as we kind of pull that data together and organize resources that may be available, we'll certainly figure out the best channel for sharing that more broadly. A couple of things I do want to elevate, because the work continues. Even despite the crisis, the work continues. And I just wanted to elevate two things that the coalition remains involved in related to the direct care workforce effort. We are continuing to partner with the North Carolina Center on the Workforce for Health, who is holding its latest workshop in a series on the apprenticeship model and how that apprenticeship model could be applied in the direct care space. So if you are interested in that topic or feel like you have some subject matter insight on that topic, we'd love to have you. It's next week in Colfax, and I will, before I stop or leave, I will make sure to put that registration link in the chat. That's coming up next week. And then I am actually going to end on a good note. Our long-term partnership with Duke University and PHI and the National Domestic Workers Alliance and UNC Charlotte to really explore the competency requirements of direct care workers and how can we better support them in their day-to-day work, culminated in the decision to conceptualize a pilot that is examining how direct care workers and family caregivers partner together. And what lessons do we as a community need to hear from our direct care worker colleagues about how we can support them in those relationships. I'm really excited to tell you all that pilot it launched last Thursday. It was really exciting. I may have mentioned this earlier, but we had 108 applicants for 50 slots. We were able to readjust resources to allow for, I think, 58 people. And we had 58 direct care workers launch that pilot training initiative last week. What is also exciting to me is not only will there be important, didactic learning, it will also be the launch of a widespread community of practice where direct care workers can come together across different sectors to think through different dynamics that they've experienced and receive support from each other in navigating those. So really excited about that work. There are some other exciting announcements from the department that are outlined in the newsletter coming up, including the Division of Mental Health's commitment, a $3 million commitment and investment in the DSP community through a release of 140 pilot grants to look at recruitment and retention. In addition to that, doing some invested and targeted work with our partners at the community college network to elevate training needs or elevate training opportunities as well. Okay, I think that's all I got.
Trish, tell folks what DSP is. Some people may not be familiar with that terminology.
Thank you, Mary. Yeah, DSP is the term that's typically used for direct care workers who have been working with folks with intellectual and developmental disabilities. So often the same worker pool as the direct care workforce, but a slightly different terminology that's usually used in that community. So thank you, Mary. Okay, I think I'm done.
Thank you. Any questions for Trish on anything? And Trisha's doing a great job of doing a lot of work to bring together the paid caregivers with the unpaid caregivers, the families, and looking at ways that we can facilitate information exchange and coordination, and just really help to strengthen both communities. So thank you so much for Trish for all that you're doing in that area particularly. So, all right, Sandra, turn it back over to you. Thanks.
All right, thank you very much. As you can tell, Trish is a little excited about what she does, which is great. That helps. And I have been very fortunate to come into a great team of folks led by Mary and the board members that are very committed to helping our older adults and the aging population in North Carolina, as well as all of you that are on this call and all of the membership. It has been a very quick last 4 weeks. 4 weeks sounds longer than 20 days, I guess. I don't know why, but it has been very busy. Everything from learning the logistics and getting the key to the new office. My first day, Mary and I moved boxes from one office to the other. So you know, sometimes you have to do that labor part of it as well. I also was very fortunate to have some meetings with some of you, some of the partner and member agencies, as well as attending the aging conference in Chapel Hill this week and attending the aging boot camp on Monday. So it's been a very good timing as far as me coming in and these opportunities to be able to learn about the aging issues in North Carolina. I will say everyone I have met thus far and have talked to even through emails, it is very evident how committed you are to this work and how important this work is for you. And that makes my job a lot more easy to help advocate what's happening and let you know that the coalition is there to help with a lot of these things that are going on, and to make sure, as we've talked about, that our voices and your voices, more importantly, are heard. And that's, you know, I've been thinking about this. We sent out an action alert week before last, I believe. And one of the things we talked about is, you know, if you can contact your local, your General Assembly legislator or your congressman, congressperson. But if because of your job, you don't feel like you can do that, then have your folks, your family, your friends, kind of let them know what you're doing, how these different discussions can impact your work, and let them contact the folks, because as Mary said, the more that people hear the stories of what's going on, I think the better we will all be. And I am new to the as far as the issues and the work that is going on in the aging sector, and I am still learning. We had a brief call. I had a brief call with Mary this morning, and I said at this point, I don't know what I don't know. So please reach out to me. I am always willing to listen and to, as I said, to really lift up some of these priorities that the coalition has, and just to get on with this work. I mean, it's very exciting work. I am pulling in all of my friends that are not quite to that 65-year age group, and they're going to be getting a lot more information from me as well. So it's been a good 4 weeks.
All right. Thanks, Sandra. Well, certainly glad to have you on board, and you have hit the ground running. We appreciate everything. So just a couple of things. Sandra mentioned the newsletter. It is going out this afternoon. February is a short month, plus there's been a lot going on, and we wanted to kind of hold off and capture as much of what's going on as we could. But we've tried in the newsletter to give a good roundup of where we know things stand, state legislature, Congress, as well as just usual informational items. So we'll send that out this afternoon. We'll probably send it out again the first of the week, since we know that a lot of folks don't read things that go out on Fridays. So we'll make sure that it gets wide distribution on that. She also mentioned the office that the coalition has. We are very, very grateful to SemberCare for giving us donated office space. And we now have an office, not only a room that Sandra can camp out in, but also kind of a reception area where we can hold like larger meetings and things like that. So thanks to SemberCare for their generosity in doing that. We have been talking to a lot of folks about things going on. We've started meeting with some legislators. Sandra mentioned the action alert that was sent out, which we hope people really will follow up on that. We are also kind of looking at an advocacy strategy for what we could do as an organization through the networks that Trish has with caregiver groups and others. You know, there might be some opportunities for some collaborative efforts on doing things. But Kay, I hadn't told you I was going to do this, and so I'm sorry, I don't want to put you on the spot. But Kay Castillo is chair of our policy and legislative committee. Is there anything you want to add, Kay, to anything that's been said today?
Nothing to add right now. I know that just the General Assembly's been meeting and having their appropriations committees and talking about all that stuff. So, but yeah, nothing else to add.
Okay, great. We are going to have an advocacy day. We are just trying to get a handle on when is the best time to do that. So we are looking at either some dates in mid-March, which is next week, or in the 1st of April. But we'll be getting some stuff out to you pretty soon relative to that. And just, you know, be on the lookout for some things coming out in that arena. Couple of things also, we continue to do a lot of presentations, things of that nature. The latest one we did was this week with the boot camp for new people that are in the aging field that the Association on Aging did as part of their conference on aging. We also are talking to reporters about things that we want to kind of generate some story ideas. We're trying to lay foundations for some articles that we hope can come out as part of our advocacy strategy going forward on things. One thing I wanted to mention is that, you know, we were part of the effort between North Carolina Association on Aging as well as the North Carolina Association of Area Agencies on Aging to collect Hurricane Helene relief funds. $12,000 was collected. So that's a pretty significant amount of money when you think about, you know, a lot of those being fairly small contributions. But those funds have been distributed. The decision was made in working with the Area Agency on Aging Association to distribute it to 2 regions in North Carolina, to the Land of Sky Regional Council Area Agency on Aging in Asheville, and to the High Country Area Agency on Aging in Boone. Boone Area Agency on Aging is going to use their funds to help support the Avery County Senior Center in their efforts to get back up and running. Their center was totally flooded. It's got to be rebuilt, but they have hit the ground running and are still providing phenomenal services with temporary resources and things like that. So it will be used to support Avery County Senior Center. Land of Sky Regional Council is going to use their funding to assist older adults in their 5-county area around the Asheville area. I believe it's 4-county area, but 2 of their counties in particular, I believe it was Buncombe and I want to say Henderson. I can have that second one wrong right now, but they've got lots of requests from individual older adults about needs they have, such as roofs, heating systems, basically making sure the roads are clear so that service providers can come in to still provide services. Just basic things that people need. And they estimate with that $6,000, they can serve 20 families with that money. So certainly very, very needed money, and hopefully, I mean, there's no hopefully about it. It's just know that money is going to be put to good use. I was just trying to see if there's anything else that's got going on. Oh, I will mention one other thing. So on January 29th, I may have said something like this before, just in talking earlier before the meeting started, is that Bob Lancata, who is probably the national guru when it comes to aging policy in the country, and I had a chance to do a workshop or just a webinar really for Central Carolina Area Agency on Aging on January 29th about aging policy at the state and federal level. Bob is excellent. I would encourage you to listen to that webinar. We do put a link of that in our newsletter that just is coming out so that you can listen to it if you want to. I know that several area agencies on aging have been sharing it widely with their folks locally. So hopefully it'll be something that would be beneficial to you if you have a chance to look at it. All righty, let's see if there's anything else that I had on my list. Oh, just the multi-sector plan on aging. We're now moving from a planning stage to an implementation stage. We've got some information about what's happening in our newsletter relative to this, but be on the lookout next week for information coming from the Division of Aging, where folks will have the opportunity to sign up to work on work groups and be engaged in work groups if they're interested in doing that going forward to move things from that planning to, actually action and implementation. So that's all I had, unless anybody's got any questions about anything going on with the division at this point. Oh, Daryl, let me call on you. Daryl Davis-Fulmer and Rosalie are our co-chairs for our Health Equity Committee. I know you guys, you have some things you want to share also, so thank you.
Yeah, very briefly, thank you, Mary. And I just want to say I saw and had the opportunity to chat with Sandra at the NCAOA along with Kay. So that was pretty nice to be able to have a few moments with you all. And by the way, that conference was excellent. The Health Equity Committee, I don't believe Rosalie is here this morning. She had a conflict. We're going to meet on March 14th. And it will be from 9:30 to 11. So Mary, I'll get some information out to you about that. And the reason being is that we're going to have a planning meeting that day. No speaker. If you would still like to come, you're certainly welcome, but all of the work groups and the committee members of those work groups are invited to attend. We want you to, because we need to regroup and plan and also have a discussion regarding everything around DEI and how we talk about it henceforth. So we want to make sure that we are in line. We are going to continue our work. So don't think that we're going to change anything. We're going to continue the work that we're doing, but we want to make sure that we're doing it in the best way to make sure that we get the work done this year. So March 14th, 9:30 to 11, planning meeting for the Health Equity Committee. So thanks, Mary.
Yep, that's going to be by Zoom. So
Yes, by Zoom.
Yep, we'll send out information.
Okay.
Okay, very good. Well, we're right on schedule. I'm trying to see if I see Dave Richards, who is our speaker. I don't see him on. He's not waiting to get in, is he, Sandra?
No, I don't believe so, because everybody was able to get on.
Okay, well, we've
Just
chatted, so I
yeah.
know he's he's scheduled. So knowing Dave, he probably had a phone call to come up at the last minute or something. So we'll just chat for a few minutes here. While we're waiting for Dave to come in, let's just go ahead with announcements and things like that. If anybody's got anything you want to share, go ahead and do that. Rachel, I know you had something to share about conference that you guys are doing that everybody's invited to.
I'm with Centralina Area Agency on Aging, and we do have our annual aging conference coming up at the end of March on Friday, the 28th. We do have Brad Allen as our plenary speaker, and we've got 7 different breakout sessions. We've got 7 different speakers for 2 different breakout sessions. So we do have a good number of presentations that will benefit the aging community.
Okay. And that's going to be in Charlotte?
Yes, ma'am. It will be in Charlotte down by the airport. We are hosting it at Harris Conference Center.
Okay. And I saw that Katie Kutcher just put information in the chat relative to where it's got information about it. So anybody can do that. That's a large
Thank you,
conference that's
Katie.
attended by a lot of folks, and it's very good every year. Folks have other things that you want to share. So Lisa or Brian with Social Security, I know you guys always have something. Y'all got anything to share?
Hey, Mary, this is Lisa. There was a press release this morning, and I want to put that in the chat. Okay.
Okay. Are you going to keep us in suspense about what it says?
Well, it's a pretty lengthy press release. and it talks about what's going on right now with Social Security as far as reduction in force, etc. But you know, just like most of the communications, we're to put it out. So I not only will be putting it out here to you guys in the chat, but I'll probably be sending out an email later today. And as you can imagine, there will probably changes as far as our ability to serve the public, especially with lower numbers of employees. So that's really about all I can say about that right now.
So y'all have had some reduction in force already, is that correct?
Social Security had kind of been down the ladder, as they say, but we're not down the ladder anymore.
Okay. All righty. So you say that this is put this in the email?
I think I just put it in the chat. It's a press release.
Yep, it's in the chat now.
Okay, so, all
Hey,
righty.
Mary, I have an update.
Okay, Rebecca, go ahead.
Hopefully a lot of you already know about this, but you know, we've been working on digital equity, which I guess we need to come up with a new name
Rebecca,
for
tell
that
folks
too.
who you are, so people know.
Oh, sorry, Rebecca Freeman, Division of Aging, and actually worked with Mary on our digital effort, it was called Ageless Access, but digital equity for older adults. And if you're not aware, these folks have been around since December, but we have digital navigators in representing all 16 regions. A couple of them are sharing a couple of regions, and I'm going to drop the information about that into the chat. The roster of digital navigators is at the bottom of the page on here. So if you're interested in learning more about it, you can click on that link. And then if you wanted to speak specifically to a digital navigator to learn more, help share the word for the counties that you're in, the roster at the bottom would be helpful.
Okay, thank you very much. Appreciate that. Sandra, why don't you, yeah, I'm gonna let Sandra take
go ahead.
over this, and I'm gonna try to call Dave, okay?
I'm in. Hey, I'm in, Mary.
Oh, okay, great, okay. Kevin, can you hold your thing until after Dave then?
Most definitely.
Okay,
Most definitely.
great.
Yeah.
Well, Dave, thank you very much. Appreciate you being here. I know you've got a lot on your plate right now. There's a lot going on, and we have a lot of folks that are attending things today that that are ordinarily here also that aren't here because of everything going on. But I want to introduce somebody to you, and I think many of you on this call know exactly who he is. He's been around for a long time. So Dave, thank you for making time to be here with us. But right now, and since he left state government, he is Senior Vice President on the McGuire Woods Consulting team for government relations in North Carolina. And of course, his expertise is in healthcare issues related to federal government, payers, and providers. And Dave, before you got here this morning, we had a presentation from the SHIP program in the Department of Insurance about some of the things from their perspective going on at the federal government. But Dave, he's for 40 years, he has led nonprofits as well as governmental agencies, particularly in the area of healthcare. For 8 years prior to going to McGuire Woods, he worked for the state of North Carolina, and he was the Deputy Secretary for Medicaid, which means he ran the Medicaid program in North Carolina. Before that, he was the Deputy Secretary for Behavioral Health and Developmental Disabilities, and he actually joined the department in 2013 as the Director of the Division of Mental Health. And before coming to state government, he was Director of the ARC program in 3 states, Delaware, Louisiana, and North Carolina. And he has served under both Republican and Democrat administrations. He was approved unanimously by the General Assembly for his position as the Medicaid director when he was there. And he's really led programs and was instrumental in a lot of groundbreaking things in North Carolina. I mean, he oversaw the transformation of Medicaid in North Carolina to managed care. And he supported providers in the state during the COVID epidemic. And he's just, and he actually made sure that we maintained a balanced budget for Medicaid the whole time that he was the director there. He's been active at local, state, and federal levels on lots of things, including the National Association of Medicaid Directors. And you know, he's a busy person. And Dave, we just appreciate you taking time to be here today and offer your perspective and insights on anything regarding Medicaid and anything else you want to talk about, because I know in your role in government affairs, you've got your finger on lots of things going on. So thanks so much for being with us.
Hey, Mary, thank you so much. And we got to cut down that thing, right? It's too many things to talk about. But let me just say, it's a pleasure to be here. Know lots of you guys and look forward to the conversation. What Mary and I talked about is that just be given a little bit of perspective on mainly what's happened at the federal level, but how that impacts at the state level, in particular around the Medicaid program. There are whole other places that we could really talk about. So let me start by saying is that, you know, over the past couple of weeks, I've had lots of conversations with people that are much smarter than me, that have good understanding of the federal process and how that looks, what's actually happening there, and what we should be thinking about. And then obviously at the state level, understanding what you know people are thinking about at the state level. And this is the first thing I should say in talking to all those people, is that it is easy to look at what we've seen from the federal government and from Congress and panic. And I think that the worst thing we can do is panic now. Maybe at another day, but right now, probably we've got to keep our heads about us because of the complexity of what they're doing. And I was on a call just a minute ago. The reason I'm late, I apologize for that, with behavioral health, the LME MCOs. And one of the things that we've seen in sort of social media posts by people that are, you know, members of their plans or parents or families, is folks saying stuff that really ultimately isn't accurate, right? They hear something one place and they'll say something on this, and I think you've seen these in the threads, right? People start going down rabbit holes and things get really weird when they do that. So I think first thing that we all have to do is just go to sort of, you know, try to figure out what the facts are. Sometimes that's hard, but what the facts are. So let me just start with, I think the thing that I think all of us are most concerned about when we see it is what's happening in the House, the Congress in the House, in their effort to get to a bill that will be signed by President Trump, right? And the big number, right, is $880 billion that they put in their latest resolution, which the Energy and Commerce Committee has defined in terms of the reductions for them to make their big proposal work. Really important to start with. What the House passed is a framework. It is not, there are no cuts from that process to anything at this point. And I think if you pay attention to some of the noise out there, you realize that there are more and more congressional folks across the country, senators, starting to say, we've got to be really careful about this. These cuts would be deep and hard to do. So really, I think really important to start there. President Trump continues to say he doesn't want to cut Medicaid. He wants to deal with the fraud, waste, and abuse. And I see the point in there about the cuts in jobs, and I'll come back to those in a minute. But his position is that we're not going to cut Social Security and Medicaid, but we're going to go fraud, waste, and abuse, right? There's a little code words in there that I think we've got to be thinking about. So I want to come back to that. But let's start with the $880 billion. And what are the things that people have talked about or potential ways in which they get them? And I'm just going to speak about Medicaid. And let me talk about the assumptions that I think that are the ones that are possible, right? Work requirements. For years, and when I say these things, I don't want them to sound partisan. I think that I'm going to say political words because they are, right? The political sides. Republicans have believed that in expansion population, that we should have work requirements. That was a stated goal in the previous Trump administration. It's a stated goal now. What's different about this conversation is they're talking about work requirements going deeper than just expansion. I think all of us knew once President Trump was elected, work requirements would be something that we have to. There's actually a trigger in the state expansion that work requirements, if there's an administration that would be open to work requirements, we should submit those. So we knew that. I think the difference now is this deeper view of work requirements across the board. I think they're going to try to push hard with that, right? I think if because say one thing I know that would pass, it's probably the one thing that will get through, because there's a total misunderstanding of that. And I think the way it gets scored at the federal level will give them more money than they'll ever get out of it, but that they will think that they're going to get money in that side of it. I think there's going to be a push for more aggressive redeterminations for Medicaid eligible individuals. And I may get this wrong, but I think in North Carolina, a redetermination happens every year. I know that there's some talk in our General Assembly about, can't we do that monthly? And what that would be is to look for people that no longer are eligible and move them from the rolls. Here's something to note about that, right? So when we were in fee for service, frankly, that didn't matter much at all, because if people weren't using the services, right, we didn't pay for them. In managed care, as long as somebody's on a roll, there's a capitation that goes to a managed care plan. So that's why that's why that idea is gonna probably get some traction in the General Assembly about ways to reduce money. The elimination of the floor for the FMAP. And this is one that I think has a chance of passing. I don't know what the number is going to look like, but if you think about the two states that are at 50-50, and that probably if you use the formula that people determine that federal participation number on, they would be below, are New York and California. And there's something about the makeup of New York and California that might be appealing to this administration. So I think that's going to be on the table before there's across the board reduction in the FMAP number.
Dave,
Yeah,
just say,
sorry.
tell people, just explain FMAP just a minute if you don't
Sure,
mind.
I'm sorry. So you know, in North Carolina right now, the federal government pays 65% of the Medicaid program for regular benefits that go through, and the state puts up 35%. California, it's 50-50 because of the formula basically is how well the economy is doing, right? And there's a lot more to it than that, but that's essentially what the numbers look like. So California, 50-50, we're at 65, but there's a floor. You can't go below that 50-50 in law right now. But if they change that, California may have to pay 45% versus the 50% of it, which would be a lot of money because of the size of California's budget. So I think that's something that may very well be on a floor on there. The other thing you hear people talk about, and this is it's a nice way to say block grant, is per capita caps, right? That's the one that in block grants that people thought about. I think it's going to be hard to get the per capita caps, and here's why. As unless there's an inflation increase in per capita caps, it's a block grant that doesn't go anywhere, right? So you say for age blind and disabled population, just use that. You know, in North Carolina currently spends $1,500 a month on those individuals, $1,500 a year. We're going to say that's what you get for that population. For you know, regular Medicaid, you get $1,000 for that, but they would not increase it for inflation. Tell the state that you've got all this flexibility to do something with it, but if you don't get inflationary increases, you know that every year you lose 5% of your federal participation in that. My opinion is I don't think they're going to go there ultimately, because I think the red states lose the most in that effort. If you think about Mississippi, Alabama, those states, if you go to that kind of approach, they wind up losing a lot, and more than other states that have more resources to do it. But I think that's the other thing that will sort of be out there. There are a couple of things on the edges. You might even talk about directed payments. It really addresses hospital issues. You know, if you remember expansion here, we did something called HAS payments. That's really a directed payment that goes to hospitals, and it lets them get up to the average commercial rate for payment in Medicaid. A lot of money, but it's going to be hard to take away money from hospitals at the federal level. But I think that'll be on the table. Provider assessments. If you look at North Carolina's budget, I think with $31 billion Medicaid program, and you know we did that 65-35 number there. But if you look at what the state general fund is, that goes into it is $6 billion. And no matter how you do your math, right, that doesn't work out the right way. That's because we use assessments in other ways to draw down federal money. And there's some other things in there, but these assessments are assessments on hospitals, nursing homes, and ICFs in North Carolina right now, which allows the state to pull that money in and then use that as match to bring the federal money down, not use state general fund. That's on the table. I'm not sure if people are going to do that because, again, you got a lot of powerful interests that would oppose that change. And then finally, optional services. Optional services, you know, when people say that, it sounds, oh yeah, that's pretty cool. You can do optional services and get rid of them. Well, adult dental is optional services, PCS is optional services, nursing homes. So there's several places that sound good to do that. They'll never get to those. So that was a quick part of what of like, don't freak out yet, right? The side of it, because to get any of those things through in a very slim majority in the House, you have to convince people to vote not just against their own interests, but against their interest in becoming reelected. And, you know, the fact that we have midterms, you know, 18 months away or before they are, that's a huge concern for people on that side of it. And again, don't take my word for any of this because things could change right on this side of it. What I think you're going to see is that they will implement some things like work requirements. They won't require the states to do work requirements until 2 years from now, right, to be in place after the midterms. And the way they'll score them, they'll say that work requirements will get you, and I'm just playing with these numbers, right? They'll get you $200 billion. Well, the way you get $200 billion out of work requirements is that if people leave the rolls of Medicaid, not because of the work requirements, it's because they chose to do that. Well, every state that's tried to implement work requirements in the expansion population have never met their targets because it's really hard to do. So they'll say they're going to get that much money, but they won't be able to get that much money. And I think it'll be delayed until after the midterms of when states have to implement them. I think the redeterminations is probably a likely thing that will happen to do them quicker, because that's, if you think about the language that people use, that's fraud, waste, and abuse, right? If you're on Medicaid longer than you should be, you do that. But we all know what happens is that people wind up, you know, their lives changed. You know, they don't show up at the DSS office every month and say, oh, gee, I'm going over my income, and so you have to take me off the program. Nobody's going to do that. There are ways that people could do things quicker, right, on that side of it. But I think that's going to be one of the things that you'll see here. I do think there's going to be consideration on an eligibility floor, but I think after that, it's going to be hard for them to get votes. For even eligibility floor would be hard because there are several Congress people in California and New York who are Republicans, and they're in districts that are swing districts or close to swing districts, and it would be political suicide for them to do this. So there's going to be a lot of that stuff to go on that side. So quickly, and I know we want to have time for discussion and questions. And Mary, I can go longer, so I don't want to, you know, have to end right at 11:30. That works. But the number one, no facts, right? Again, I've seen people say stuff that is not accurate on both sides. And we've got to be the people that are factual, right, on this. Because if you go to your congressperson and tell them something that's not accurate, immediately you lose credibility there. So you need to speak to Congress folks, right? And there's lots of ways to do that, continue to do that, but make sure we all have the facts as we do it. Our legislature, don't forget them, because they're setting up a committee to look at these issues. But if the changes happen, they're going to be responsible to figuring out what to do next. So think about what really hurts people, right? If somehow, I didn't mention, if they reduce the 90% commitment on expansion, there's a trigger here that we wind up losing expansion, right? We no longer do it. So expansion, I think people have realized this, helps an enormous amount of people in rural areas, helps rural hospitals. And if you think about where the majority of the Republican legislature is, it's from rural communities. No one in that community, well, it's probably not true. Most people in a Republican majority do not want to take a benefit away from people in their districts, right? They may say things like, we want them all, you know, able-bodied people working, and you'll see the law coming up about that crap, right? And it's not, but at the end of the day, they don't want to take benefits away. So it's important for them to know what the facts are. In the oversight committee 2 days ago, the Department J gave some really good numbers on one slide. I think, Mary, you probably have that shows what would it mean in North Carolina, the total dollar amount, if they got that $880 billion, right? It's staggering. The members in the Appropriations Committee and other members there know they can't make that money up. And secondly, they don't want to make that money up because they don't want to have that problem with their constituents. So I think focusing on our state legislature is a really good strategy, making sure they understand what has happened to people. One thing I've heard people say, and this is where I think folks have to realize this, they say, well, you know, if what the issue is we do per capita caps and it just, you know, it affects those people that just get Medicaid that are able-bodied and, you know, aren't the people with disabilities and people who are older. And they believe that somehow that'll protect people who are older and people with disabilities. That's a lie. And just, we've got to be really clear about that, is that there's no way, if the worst happened and, you know, the federal government was going to, or Congress was going to reduce by a significant number of billions, it will impact everybody across the board on these programs. So I think that's one of the things that people have to be clear about. You know, where do seniors use Medicaid? Well, Medicaid's in lots of places, right? Obviously, healthcare, dual eligible side of it. It's facilities where people, you know, nursing homes, adult care homes, in-home PCS, other kinds of places there. It will impact everybody if it happens, if they make these deep cuts across the board, and nobody's going to be saved, because you just can't. And the last thing, one of the things Jay's presentation did as well, is showed the number, how much money it costs for people who are older and people who are with disabilities, and what a percentage of the Medicaid program that is versus the rest of the program. And we've known that forever, right? Is that obviously those costs, those residential services cost more money, and the more intensive services cost more money. So there's no way they could leave a population out if they had to make deep cuts. So I think we have to be really clear with members about that side of it. Last thing I'll say is that it's going to change. Every other day it's going to change. Be careful what you see on Twitter or where else on that, because it may not be true. I know that you guys, and we will, in the state, will continue to put information out that is more factual, because we don't want people going off on rabbit holes on that side, but it's going to change. But right now is the time to be talking to congressional folks and talking to your state legislators about this issue. I would encourage you, you know, it's not in your face, right? You people are terrible, horrible people, because they never listen when you hear that. It's more of, you just need to know what it means to the program that I care about, that I benefit from, or my relatives or friends benefit from. And it will impact not only the individuals, it'll impact the economy in a way that is really devastating if you're going to see. Mary, I was pretty quick. I'm sorry. I don't know if I got what you needed out of there, but I'll stop, and then any conversation we can have. How's that?
That's great. Thank you, Dave. That was a great overview, and certainly value your insights. Just to pick up on what you said, the presentations that was done by the State Medicaid Director, Jay Ludlam, and also by the research staff at the General Assembly are on the website for the Health Joint Appropriations Health and Human Services Committee. So you can go to either the Health Committee in the House or the Healthcare Committee in the Senate and find those. To make it easy for you, though, in our newsletter that is coming out, we have got a big section in there called Lawmakers Make Budget Deliberations, Medicaid is Front and Center. And in that, we do a lot of sharing of some of the things Dave's talked about, but also we give you the direct links to those presentations, as well as a link to the state fiscal year 2024 Medicaid report that the Division of Health Benefits, which is the Medicaid agency, does every year. That gives you a lot more detail about who served, expenditures, things of that nature. So that information is very factual if you want to use some of that. Just to pick up on what Dave said, in North Carolina, 21% of people on Medicaid are older adults or persons with disability. 10% of those are older adults, 11% are persons with disabilities, but they account for 54% of Medicaid expenditures. That's 16% for older adults and 38% for persons with disability. And as he said, a lot of the services that older adults get are very labor intensive. It costs a lot of money to pay for someone in a skilled nursing facility. It costs a lot of money to keep somebody at home with personal care services or community alternative program for disabled adults. That is why you see, kind of a lot of high costs there. That's much more expensive than making sure that children get vaccinations and things of that nature. So it is a big ticket item for the state. And as Dave said, when people say, well, we don't want to cut services and programs for older people and persons with disabilities, but they're going to be impacted if we have that. But I do think, Dave, one of the things you said, which a lot of people have tried to remind me of this week, is we need to get out there and do our job, tell our stories, get factual information out, but not push the panic button, because a lot of stuff is going to happen. This is going to take a while to unroll and all, but if we let those individuals who are making these decisions know what the impacts will be and what it means to their constituents, then, you know, that's a good first step. So that's kind of my soapbox too. But I want to open it up for questions for Dave. I mean, he's like the guru of policy when it comes to these things. So ask your questions that you have. And Sandra, if you would help monitor when hands go up. I see Dick Shady right now has got his hand up, so we'll go to Dick
Yep,
first.
Dick's is up.
Go ahead, Dick.
Thanks, Dave, for that detailed briefing. I think that's the best inside baseball on all this that I've heard in a long time. And I just wondered if you had a focus on a slightly different way. When people talk about this, they tend to think of Medicaid as some kind of even cash assistance program that goes to poor people in welfare cases. And of course, those people don't have a lot of sympathy. So when people talk about cutting Medicaid, that's what they think. But the truth is, as I understand it, 2/3 of this money goes to hospitals and nursing homes. And if you take a serious amount out of it, instead of thinking about some individual who has to report working, you're thinking about what does this do to the financing of the nursing homes? And all of a sudden that individual that you're focused on is somebody getting a phone call saying, if the nursing homes have to close, I'm terribly sorry, but you're going to have to take your mom home. That's what this means. And I wondered, do you have a focus to answer this from the point of view of the institutions, the nursing homes and the rural hospitals, who are already under tremendous stress, and that's what the politicians are also facing?
Yeah, I think it's a great point, and it's sort of, it's like who tells what story, right? So I am 100% confident that at the nursing home level, those associations are telling that story. But it's an important one for you guys to know, right? Is that, and when I mentioned briefly the economy, if you think about a community, and I won't name any, but a community that has a rural hospital in it, and somehow that rural hospital closes because of these things, their economy, it's not just what happens to the people and their inability to, you know, get the service they need. The economy collapses, right? So a little small town that's got a hospital close to them, it collapses. Same thing, if you have a God forbid, a nursing home has to close in a local community, well, there's a lot of jobs in that nursing home that go away. So it goes beyond, you're right, it goes beyond the individual being served, but it's also the rest of the system that's part of there. You know, I just say this, is if some legislator says to you, is there waste or fraud in the system? Of course there's waste and fraud in the system. It's you know, in North Carolina, 31 billion. If there wasn't, you would be, you know, would be lying, right? There are places where people, and I will say this, it's not typically the beneficiaries, it's others that wind up doing this because they're just, you know, some population's bad, but you don't get rid of it by doing what this is. What you do is you actually strengthen those systems in which you would monitor that. I saw something in there, and I didn't get the numbers, but, you know, if you wind up cutting what they're trying to do, right? So many people out of government that does that work, then you actually probably increase the possibility that you have more fraud. So I think the idea here is nobody's against, you know, rooting out fraud or waste. What we're against is indiscriminate efforts to actually eliminate a service for people that desperately need that service, right? And that's what this really will do if they were to get as far as they need to go.
Dave, I think that's a good point for our messaging also, is that you're right, nobody's against fraud and abuse elimination, but it's how you go about doing it that is also a good talking point, I think, for what we're talking about here. I see some comments in the chat. Any other comments for Dave though while we got him? We're lucky to have him. So I think everybody has saturation of things from the week for sure. So Dave, I know North Carolina legislature, the House has proposed the bill to basically establish a commission that will look at things. And I know what they're trying to do is maybe get ahead of some of the things that might be coming down the pipe, but any thoughts or ideas on that and what we might do?
Yeah, I mean, I'm actually hoping that, because it was a House proposal, I hope the Senate takes it up on and they start a joint effort on that. Because again, to me, the most important thing is that people understand the facts, right? Y'all know this, you do this all the time, is that I told this, you know, when I first started at Medicaid, I think half of my family thought I was doing Medicare because people don't know the difference, right? They don't understand how things work. Most people don't understand the state commitment to this, right? And there's a state and federal government position. And you know, it's got to be cautious, right? Because the idea that, you know, it's all taxes, all taxpayer money, and you can get caught in a trap when you say, well, you know, the state of North Carolina does so good on this, but it's also for those people that are appropriators. Again, think about the deal that North Carolina gets of getting our taxpayer money back. And I think this is the way to talk about it, right? Is that we put up $6 billion and we get $31 billion back for healthcare in North Carolina. It's your money, right? It's all our money that we've been putting into it, but it's what we expect out of our government. And a way I've said to people is that I am fully, I have no trouble with my taxpayer dollars going to fund these kinds of programs. And I have no trouble with North Carolina being efficient in using those dollars from the federal government that we've all paid into to make sure that we have healthcare in North Carolina on that side. So I think, you know, you're going to get arguments back from some people that will be, you know, well, we got to reduce the taxpayer dollar. There's money out there to reduce. This is not the way to do it, and you're never going to get that 880 billion without really harming people in the economy.
And you know, even though it's 800 billion now, 880 billion now, we don't know if that number will stay that number, you know.
And one thing I should have said at the very beginning, that's 880 billion over 10 years. And so
Exactly.
I would anticipate what you would see in any bill that comes out is there would be very little money in the next 2 years that they would expect to get. It'd all be backloaded, which means that one is they may never get to it, right? And sort of that's the call it stupid pet tricks, right, about financing. But they're not going to, it won't be that they're going to get, you know, whatever 10% of that is, you know, the first year. It's not going to happen. It's all backloaded on that side. And so one is, I think, watch for, they'll make decisions that look like they're going to get that money, but it's not going to really happen because of the way it goes. And I think that plays to our advantage, right? Is that, you know, none of those politicians want to see deep cuts in the next year and a half because they got an election coming up. And that goes for our state legislature, right?
Yeah, and picking up on that too, I mean, right now we have different people in power that weren't in power the last administration. We could have people in power the next administration that aren't in power this administration. So, you know, so it is a revolving door that reflects a lot of the, you know, the positions of people that are currently in power. You know, so anyway, I know somebody had a question. I could cut you off. I don't know who it was.
I think
It's Marty
was-
Lamb. Okay, Marty.
it's
And
trying
Marty, you're
to.
breaking it up.
Oh, sorry. Could you turn this down a minute? Hi, Dave.
Hey, Martin.
What I was trying to see, I think your use of the term indiscriminate was a good one. No, everybody in this call comes from different direction, but to the extent we can come up with a unified message, we'll have a greater impact in talking with our congressmen. So are there other suggestions? Is there a nice statement that you think might apply to all of us that would be a good verbiage in addition to the comment about that we're against indiscriminate waste, that you could feed us in talking to our legislators?
It's a great question, Marty. I think, and it probably changes depending on where you sit, right? So from me, when I'm speaking to people, I try to speak from, you know, well, I have a history with Medicaid, and it's not just as Medicaid director, it's a history of when I was with the ARC. And I'll just tell this quick story, right? So when I started volunteering with the ARC when I was a teenager, which is, you know, 100 years ago. And at that time, the only place that family members were really hoping they could get their child of severe disability was in a state institution.
Mm-hmm.
But at the time, those state institutions were fully funded by state dollars. There was no federal money on them. And you know, the evolution happened is when Medicaid dollars came in, the quality of services in those institutions went straight up, right? They were, frankly, they were hellholes. Wrong way to say it. Were there. But if you had a child with disability, you know what to do. That's the only place you could get to. Went straight up. And then community services came in. And then, you know, people had you know, group homes, and then people had individual supports and services. The world is entirely different for people with disabilities, and that was my perspective, than what those families could have imagined when they were trying to figure out what to do for their son or daughter at that time. And it's because of Medicaid. It's not because of some other thing. And I think that probably is the same trajectory that happened. I don't know it as well for the Asian community, right? What people could have expected, you know, 60 years ago, and what the world looked like is significantly different. But the biggest change has been the influx of Medicaid dollars into that system. And so it's not, and that, so it goes a little bit back to what people know, right? So if what your inclination is, because all you've been seeing is some of the negative stuff about the Medicaid program, and it's, you know, the thing they use, right? You know, able-bodied people, I saw this guy say, there's all these able-bodied people sitting in their basements playing video games, and they're on Medicaid, right? Well, we know.
And their Cadillac sitting in the
That's right,
driveway.
Cadillac. We know, I'm sure there is somebody in North Carolina that's the case, right? But what we know is that it is you know, whatever percentage of less than 1% you can get to almost nothing, that's the case. But what many people don't know, right? And I would think rank and file new legislators don't know, is that without, you know, I think it's the right word, right? Is that if you are if you're older and you wind up going into a nursing home, odds are you will be on Medicaid at some point in time, because that's the only way that you're going to be able to pay for it. And that's not a knock on the cost of nursing homes. That's a knock on, it's expensive for long-term care, right? And I don't think rank and file members understand that, right? What they think about, they may be getting this weird stuff out there. And I think it's making sure that when you tell the story, you're telling it from the position of, this is what I know, and maybe you don't understand this, right, on that side of it. So I don't know if it's one message, but it is, you know, Medicaid's a complex program. There's a lot of things that happen in there. And what you need to understand is that it's not that person sitting in a basement. That's not who this program's for. This is really about a wide variety of people that are poor, that are working, for people that are older, that need supports and services, for people with disabilities. And I think that's a much more of a winning argument, right? When you're talking to people, is to make sure they understand that distinction.
Thank you.
Dick, Dave, just to pick up on that, almost 2/3 of persons who are in nursing homes in North Carolina right now are on Medicaid. Now, they didn't go in that way, a lot of them. They had those resources. They had that little nest egg. But when you're paying $80,000 a year or whatever for care, round-the-clock care, it doesn't take long for most folks' nest egg to not last very long. So, and I think one of the things that we've got to do is, as you said, we got to put this face on the issue. I mean, and personally, I have a family member who is developmentally disabled, and she is on Medicaid, and it allows her mom to work and to really do a lot to contribute to the lifeblood of her community. And, you know, in telling stories like that, you know, put a face on the issue, because if it was not for Medicaid, none of that would happen, you know, because you've got to have, you just can't, you know, wave that magic wand, and the needs of folks that need supportive services and healthcare and things like that are going away.
That's right. Yeah, I think that's right. It's that story that is so important. And what I just I'll add is, when I say that, I think elected officials don't understand that. You know, I think about if a member of the General Assembly, right? And they come in, they're a new member of General Assembly, and you're a business person or whatever, why would you know that, right? That's not in your daily knowledge, right? Because you might hear these stories, or you just maybe didn't think about it ever. So they've got so many other things they're dealing with. I think helping people understand the reality of what the program is the best thing that we can do, because frankly, you know, the Medicaid program, I think, sells itself when people understand what it really does.
And I do think in North Carolina, particularly the people that probably will lead up the effort to look at how North Carolina responds to this, they're pretty savvy folks, and our legislators that are in this position. They know this type of information, but it's a kind of like thing about what can we do to help them to.
That's right. That's
to
exactly.
to get the message across and all too. Other questions from folks? Anything in the chat, Sandra, that we need to look at? Don't see anything. Okay. Well, Dave, certainly don't want to keep you any longer than need be for sure, because I know you're really busy. But as things come up, if the things you think that we can do to help be a part of getting the stories out, sharing the message, just doing what needs to be done to talk to the right folks or whatever, let us know. We certainly, we're all in this together. And I think we've got a lot of conversations going on right now about what strategies should be and what we need to do. And I think the big thing is there is a period of time we've got to work with here, because some decisions are going to be made in the next 6 months, and we're going to have to be reactive to those. This is going to be a long-term type thing too. So we need to keep it in perspective that, it's not going to be over for a while.
That's right. I was with someone last night who has had a lot of experience at the national level, and she said it's important to remind people that we're in the top of the first inning. This is a long thing. Yeah. So I think you're right, Mary. And I look forward to having more and more conversations and coordinating with activities on this. So thank you.
Thank you. Okay, one last opportunity for questions. We don't hear any. We're going to let Dave go.
I don't know that this is for Dave. It's BJ Mary Bethel. I
Okay.
really do agree. It's really important because I think there are a lot of emotions. There's reactiveness to the fact that our government is operating on Twitter #X. So what to believe. So in preparing to appropriately talk to our legislators and Congress, is there a way that we can, in fact, get on like a talking point page and kind of explain what the fallout would be and the actual extraordinary expenses and costs to getting healthcare and taking care of our elderly, and the pressure that'll be put on families, and because it's a tsunami effect, right? So does that exist, or is that something we're working on collectively?
I think the coalition is having discussions regarding things like that
Okay.
right now. But I think everybody is just trying to figure out how's the best way to do it. And I know every constituent group is doing the same thing. The disability community is doing it, the mental health communities are doing it, the people in the insurance industry, they're all doing it. So I think in the next couple of weeks you'll begin to see that people and organizations and groups will begin to coalesce on strategies and things like that.
Okay. And is it a dangerous place to attempt to point to the tax breaks for the billionaires and the corporations? Because I think it's been proven trickle down economics does not help. It just helps pocket more money into corporations that raise the dividends. It's shareholder buyback. So there's like so many moving parts that if they would pay their fair share, that I think some of this could be mitigated. Even Warren Buffett is saying, hey, this doesn't have to be the kind of crisis that is being purported out there.
Good point, BJ. Dave, I don't know if you're still on. It looks like
Yeah.
he might have dropped. Are you any reaction or thought to that?
Yeah, I think that really, so let me just say this, is that, from every day when I hear stuff, right? And this, again, I'm trying not to be political about it, but it's just where we are as a country, and some things that, when people talk about government employees, the way they talk about government employees, I wasn't a federal government employee, but I was a, state government employee, and people work their butts off, right? They're like every place else. There are some people that aren't great, and there are some people that are outrageously good, but most people are in the middle, they do their job. I want to scream and yell. You know, I have my opinions on foreign policy. I want to scream and yell. The problem, I think, is that if you bring too much noise on other issues, right, then the focus gets lost on this. So here's my suggestion: is right. I would not raise the tax cut issue in that. It infuriates me too, right? Because there's a balance here that you should get to, but that's actually Congress's job to figure that out, right? How to manage it. Right now, in this area, right? I think our job, your job, is to make sure that they know if they make these cuts, what's going to happen. How to fund the not make cuts. You know, they don't do the tax cuts, they don't have to worry about it, right? And listen, I think we all want, you know, a much more balanced budget, all those other things. There's, you know, I'm not a finance person on that side of it, but that's an issue they have to. But because I'm afraid if you go there, then immediately they'll label you as a person that's opposed to their broader agenda, and I don't think you want to be there. Now, maybe there's a way that, you know, you do one thing, which is focus all on this, and if you want to get to the tax cuts, have somebody else in your family talk about that, right, on that side. But I think you want to be the voice of, this is singular, this is why I am writing you, this is why I'm talking to you, because if we reduce these, we're going to hurt real people, and there's no way else to support these individuals. And, you know, other things about, you know, Dick, as you mentioned, the hospitals and everybody else. But I think I'd just be cautious about mixing that message.
Thanks for that.
appreciate your point of view. Thank you.
Other questions? I don't see any. So Dave, thank you so much for taking time to be with us. Again, look forward to continuing conversations on things.
Yeah. Thank you, guys. Have a great
Take
day.
care. All right. Bye-bye. Okie dokie. So, I think his message was very succinct and, you know, good points for sure. Any comments or thoughts on anything that you didn't ask before? Yeah, I kind of feel like the air's been sucked out of the room at every meeting that I've been in this week, you know. It's I think, you know, we all kind of like, we didn't think it would be like this, but it is like this. So we just kind of, you know, are catching our breaths and figuring out how to move forward, I think is what most folks are doing at this point. So anyhow, moving on, I know that Kevin, you were getting ready to share something with us and I cut you off. So we'll let you back to you.
No problem, Mary. I know this is down the road, but I just want to get it on everybody's calendar. But I'm also here representing the North Carolina Partnership to Address Adult Abuse. And we're going to have our annual conference on May the 20th. And it's going to be held at 111 Place, which is 111 Realtors Way in Cary. It's really the Realtors Association's conference center. And we got a great agenda. It's going to be from 8:30 to 4 that day. And we actually have Bill Benson. He's the National Policy Advisor with the National Adult Protective Services Association. And he'll be one of our speakers for the day. We've got other sessions that'll be named later, but I just want to get the date out there for May the 20th for folks. And you can go to the ncp3a.org website and more information will be there, along with the registration will be coming out soon. So.
Thank you, Kevin. That's good. Yeah, Bill Benson's an old warhorse too when it comes to, he's been around for a long time, very well respected. So kudos to you guys on getting him as a speaker. That's great.
Yeah.
Okay. Any other sharing anybody has? I think there's a lot of spring conferences and things that are getting ready to happen. Certainly, look at the calendar of events that will come out in the coalition newsletter. Also, just if you have things going on, let us know so we can add them to the coalition newsletter. You know, some of the things may be closed just to your members or whatever, but it does help people to know what else is going on when they're trying to schedule meetings, things like that also. Katie Franklin with Services for Deaf and Hard of Hearing, I see you. Do you guys have a new division director yet? I know that
We do. So as many of you know, our director, Jan Withers, retired just recently, and we do have a new director appointed, and it is Tony Davis. And so many of you likely know him from attending these meetings when he was in my position in the past. So we look forward to his leadership and hopefully getting you all a chance to meet him soon.
Great. Yes, Tony came, he was the you from before you were you here. And he came to
Right.
many of our meetings, so that's great. That's great. Is he effective already? Or is this already?
Yeah, he's really hitting the ground running. It helps when you have someone from within who's already familiar with everything, so they don't need that that period of time to really catch up and see where we are and where we're going. So
Right. Yeah, and even though there's a new secretary at Health and Human Services, I don't think there's been any wholesale changes in personnel for the most part. So things are fairly um, stable there. I see Dick's put a message in that Representative Richard Hudson from North Carolina is the only member of the committee that deals with a lot of the things that will be taken up, Medicaid and other types of things that we are concerned about. On the Senate side, you know, Senator Tillis has been a good advocate for aging issues also. So he would be a person certainly to make sure we're in communication with on things. Anybody else got anything? Just one other thing, I keep thinking of these things. So everybody's talked about the importance of communicating with elected officials. In the action alert we sent out last week, we gave you information about how to find all your elected officials, both at the state level and the federal level, how to get their phone numbers, email addresses, and things like that. It is important that they hear from you. Everything that you send in it becomes part of the numbers of how many constituents did a legislator hear from relative to an issue. So you might get kind of a generic response back if you get one, but they do keep account of those, and that makes a difference in how you know, a lot of times in positions that legislators as well as members of Congress take on things. And do send and stuff and get your families and friends to do it too. People are just generally reluctant to do things like that. They don't want to tell their story. They're private. They want their businessmen out there. But we are at the point where we need to tell those stories. I think I'm sorry to sound like a broken record on that, but that's kind of where we are, I think, at this point on things. Our next meeting coming up is going to be on March 28th. And as I mentioned a few minutes ago, Secretary of Health and Human Services, who was scheduled to be here today, is deferred to the 28th of March. So we look forward to having him as our speaker at that point. Look for your newsletter in your inboxes this afternoon, and we'll send out the slides from Melinda, as we said, later on. So anybody else got anything good for the cause?
I just want to say thank you for everybody who has stayed on the call, and thank you for your interest and commitment, because that's what I felt just in the 4 weeks that I've been here, is people are committed to helping the older adults, regardless of what's swirling around us. And that's the most important.
Yeah. All righty, guys. Well, take care. Have a good rest of your day. And when we convene next time, it's going to be springtime. So let's hope for good things in the spring. Take care. Bye-bye.
Bye.